excited about being a part of Black Cannabis Week. Some awesome just content and education and resources going to be provided throughout the week. We're talking about health today, and specifically, we're talking about sickle cell. September is also Sickle Cell Awareness Week. Month. And so I am a sickle cell mom. My son, Brian, has sickle cell. He has a full-blown disease, and I proudly represent this community. I proudly represent my son. I represent those individuals that are affected by this disease who need more support, need more resources, need more education. And we're going to talk about how, not only about my story, about the plant and how this plant can make a difference in regards to a person's healthcare, their quality of life, their pain management. So thank you for this journey. Thank you for being on with me. And let's just talk a little bit, man. And like I said before, I'm a sickle cell mom. And what does that mean? That means that my kid, in 1998 was born. Brian was born only 1 pound, 13 ounces. And he literally he would fit. He had little legs that would dangle off the side of my hand. He would fit in the palm of my hand. And that's how big he was. And so he spent about 3 months in the NICU. And, primarily the NICU he was there to just grow. Basically, they created an environment that was similar to the womb and allowed Brian to grow. But one thing I don't know if you guys know is that anyone of African descent that has a newborn born in this country, that newborn is tested for sickle cell. Sickle cell is a genetic disease predominantly seen in people of African descent. And so one thing that's happened throughout the years, because it can be such a debilitating disease, is that genetically hospitals have put policy into place that says if you are born in a hospital and you have of African descent, so African American, you're tested for sickle cell. So Brian was definitely tested for sickle cell. But what happened was Brian was tested after receiving a transfusion, after receiving medical care, because he was a preemie. He was a NICU baby. And so what happens is that when you have a transfusion brought in of new blood and you already have sickle cell, your predominant red blood cell is sickle, you are a sickle cell disease carrier. When you have that transfusion, you end up changing the matrix, the mix of that testing. So his test came back that he had sickle cell trait and not the disease. So we went on as a family. Brian was in the NICU. He was born August 10th. We took him home around October 31st, around Halloween time. We're very excited as a family. Brian has always been a warrior. That's his name. It means warrior. He was just a great kid, a baby that just continued to grow and flourish. No issues with being a preemie. However, we had some things that were happening. Brian ended up losing the use of his left arm. Just was in pain and basically had we know now it was a mini stroke, but couldn't use his left arm. And then 6 months later, same thing happened and it was on the right arm. Couldn't use his right arm. And so, mom, dad, my mother, everyone, we're like, what's going on with Brian? What's happening with him? And we had an incident. We were flying from California to Orlando to see my mom and my grandparents. And Brian passes out on the airplane, loses consciousness. So they have to do an emergency landing in Dallas. We don't know what's going on. We get to Florida. We're still seeing him. He's up and going again, but something is just off. So, you have, like, as a mom, you are just overwhelmed sometimes trying to figure out, making sure you want to make sure your kid is good. This is your baby. And so I'm stressed about that. And so I went to his pediatrician. I said, hey, listen, something is going on with my kid. I don't know what's happening, but I need you guys to help me figure it out. So at the time there was a physician assistant there because his pediatrician was out of the office for a week. And the physician assistant said, Roz, let's do a panel of blood work for everything. Anything that we can think of, let's do a panel. And do you know that after they did that panel, they found out after getting the results back that Brian had sickle cell. And so we were devastated because we didn't know how it got missed at the hospital. Now we do. But now it really, we now knew why he was having these issues with not being able to use his left arm, not being able to use his right arm, having the passing out situation, because he was basically having a crisis as a baby. And so we quickly learned about, pain management. We quickly learned about how to care for Brian. We quickly had, these healthcare professionals who immediately put Brian on a hypertransfusion program. Basically, they felt like Brian, because of his many strokes, that he was. I would say he was presented as maybe a high risk baby that would have more strokes and more complications. And so he became one of the patients, the first one at Cedars-Sinai, that was basically, they did a mobile type of transfusion. Instead of putting him on a machine that whirls around, that transfuses blood out and puts new blood in, they did it manually with these different vials. And so I won't like bore you with all of the technical and all the medical stuff, but just know that we went through a lot and we learned a lot. And the one thing that I want you guys to understand is that we need to embrace this community, because I was someone who worked in pharma. His dad was someone that was, entrepreneur. We were hands-on, but there's so many families who need support, who need answers, who need advocates, who need people to advocate for them. Sickle Cell Awareness Month is all about, let's put eyeballs to this disease. There needs to be more money that comes towards research on a cure. Do you know the only cure there is for sickle cell is a bone marrow transplant? And we're going to talk more about that. But let me share a little bit with you. I want to share some points. It's really critical. And I want you to walk a little bit more with me about this journey about sickle cell and why it's important for us as people in the cannabis industry, as well outside of the cannabis industry, to care and to figure out how we can make a difference. So hold on one second. One second here. All right. So one of the big areas that we have an opportunity to really be able to advocate for, to support, is to making sure that our patients who have sickle cell, those who are in need of cannabis as an option for pain management and anxiety relief, know about your rights, know about community resources, and that you get the support that you need. I'm so excited to tell you guys that when I started M4MM, my whole purpose, to be honest with you, was twofold. First, it was my son, the fact that he was 17 years old when I first started this organization. And I wanted to make sure that once he was able to make a decision if cannabis was going to be the right fit for him, that he didn't have to be targeted. He wouldn't have to face any backlash, any stigma around using this plant to help control his pain. And I'm happy to tell you guys now that Brian is a card-carrying medical marijuana patient that knows exactly what works for him. He's able to control his pain. He stays out of the hospital. He's able to manage the things that go on with him. Also, when it comes to anxiety, when it comes to stress, can you imagine this disease? It presents itself in this pain, and we're going to talk about where the pain comes from, but you don't know when the pain is going to come. You just could be walking down the street and all of a sudden you can feel this extreme pain and have to figure out how to manage that and how to cope with that pain. This is something critical. And one of the areas and one of the opportunities of supporting individuals with sickle cell is with cannabis. So we remember that the history of cannabis from the start, the 1600 American colonies mandated the growth of cannabis sativa for hemp. We understand this plant has been around for centuries, right? We understand that in 1937, Marijuana Tax Act taxed growers, purchasers, and users, making it virtually impossible to obtain cannabis. Even though prior to that time, if you go back and look, the 1600s, the 1850s, this plant was a well-known product for medicinal purposes. But 1937, that changed. Right? State laws later made cannabis illegal. Moving forward, 1970, the Controlled Substance Act. Remember, it reported that marijuana had no potential medicinal use. How are you going to tell us in 1970 there's no use, whereas in the 1600s, in the 1850s, it was identified and it was actually reported, and you had anecdotal evidence showing that this plant had medicinal use and was able to help and support patients. And then, of course, the 1970 Act determined that marijuana was status as a Schedule I drug, along with LSD and also some other different, severe, drugs that cause a lot of, not mental issues, but euphoria type of drugs that really are synthetic in nature. They put cannabis in that Schedule I drug category, which was inappropriate. Now, as of 2020, cannabis is legal recreationally or adult use or medically in 33 states, including Nevada. And this was a presentation that I did in Nevada, hosting about having this conversation. So let's talk about sickle cell anemia, right? So as you guys can see, the picture on your right, that is a patient. That is a patient's, that's their vein, and then that's their red blood cells, right? So the red blood cells, that if you do not have sickle cell, your red blood cells are nice and round. They're not sticky. They're smooth in nature. They carry oxygen. Remember, red blood cells carries oxygen to all parts of our body, our brain, our organs, our heart, our lungs, it is the carrier of life, right? So when you have sickle cell, when you are a sickle cell patient, your red blood cells are not nice and round and smooth. They are a crescent shape. They are sticky. They have points to them. Imagine if you had a star, and if that star was going through your veins, that star shape was the shape of your red blood cells. Imagine those pointy ends trying to go through your joints or what have you. That's where the pain is caused. So the treatment of sickle cell disease, you can see it from a palliative care perspective when people are dealing with end of life. You can see it from a preventative perspective, from a pharmacotherapy. There's a drug called hydroxyurea and L-glutamine. There's also other different therapeutic pharmacotherapies that are available. And then there's curative therapy. The only cure for sickle cell is bone marrow transplant, gene therapy, stem cell transplantation. And so right now, we need to be talking about that. How do we cure? How do we create opportunities of conversation about having more people of color in the database so that bone marrow transplants are available? And we're going to talk more about that. So I won't digress, but I want to keep going here. So the management of sickle cell pain, again, so you see this picture, right? So the picture you see the nice round red blood cells. Well, the ones that are oblong, those are sickle cells. And so the more that you have, like, for example, Brian's sickle cell percentage in his body is about, without a transfusion, is about 67%. So look at this picture right here, right? So 67% of his red blood cells in his whole entire body are sickled versus round. So can you imagine if you had all of these sickled cells in your body, if they start clashing, if they start going through your veins and start getting stuck, what ends up happening is that you have joint pain. You have pain in your arms, you have pain in your back, you have pain in your lower limbs. You can also have something called, and these pain episodes are called crises. They're called sickle cell crises. And so as Brian was getting older in life, we would have, he would have, I can't even tell you guys, it's so sad. Sometimes it breaks my heart, because my son would be in so much pain. And I remember driving down La Cienega, headed to Cedars-Sinai, because we were living in LA, and he would be in the back seat and he would just be crying in excruciating pain. He's like, "Mom, I can't take it. I can't take it." And it would just pull, it was just so sad knowing that, Brian didn't have, he didn't have a choice in regards to pain management. There's non-opioids, there's other different alternative medications, and then there's opioids. And so opioids are like morphine, Dilaudid. There is a non-opioid called Toradol. These are just medications that are administered to patients in order to control the pain. And honestly, as a child, the only way that we could keep Brian out of this crisis phase where he wasn't having to be rushed to the hospital every single, once or twice a month, was these blood transfusions. And the transfusions basically are that's the way that you trick the body. So he would be on this basically a regimen every 3 to 4 weeks. He would be on a schedule, and that schedule he would go into the hospital. They would put him on a machine, and during this time he was still little, so they would do it manually. And basically, they remove X amount of percentage of red blood cells from his body, and they would introduce, through people that donated blood at the blood bank, new blood into his body that was good red blood cells that would be able to get oxygen to his lungs and get oxygen to his body and his organs. It would be able to reduce the pain issues that he was having. So until this day, and Brian still gets exchanges, he's still going and getting this type of treatment. That's what really worked for him. And that's what so many patients they go through. It's been discovered that medical cannabis can enhance sickle cell patients' mood, but more research is needed for long-term pain management treatment. We know, and we're seeing, and more studies are being shown, that the use of cannabis, especially once you understand what's the right strain, what's the right ratio of understanding acute pain versus your body aches and pains versus anxiety. Do you guys understand that with cannabis has the ability to have these different plants, different terpenes, different percentage of THC versus CBD can provide different type of relief. And so again, there's more studies about this, but right now I'm so proud that my kid has been able to understand and being able to figure out what works for him. And the reason why we're here today, we want to encourage you. If you know someone that has sickle cell, if you know someone that's been struggling, encourage you to have them look at cannabis as an option. It's not the end all be all for everyone. No, we're not trying to get people high. We're trying to give them an alternative. Opioids, I mean, I can't even tell you guys, the opioids, when it comes to what happens when someone takes them for an extended period of time, you end up having the itches. You basically are almost like you're on, I don't want to say crack, but you're on this medication that causes your bowel system to stop. So you have to take medication in order for your bowels to move. It causes like, we had, one point in time when Brian was little, he had like this, I don't want to say out of body, but he had a psychotic moment. Sometimes these medications can cause that. They cause you to have, a reaction. Just so many different things that happen. And so what we're trying to do is look at alternatives, look at different options. And what we want to do is make sure that folks know your rights, that you have protection under a law, that if you're a patient, this is why get your card. Get your medical marijuana card. Make sure that you have a caregiver that understands why you need your card, what type of medicine works for you. You're exempt from arrest and prosecution. We want, if you're in a state-run medical program, we want to encourage you to get registered. You see our information. If you share this, and if you have someone that needs more hands-on, support on getting registered, they need help in getting their initial card, or they can't afford the initial patient physician visit, call us, email us. We're here to help. Again, cannabis patients, and if you're someone that needs your card, the things that you want to remember is your primary physician or your specialist, your oncologist, they need to write out a office note saying that you are a sickle cell patient and that you have been suffering from pain management issues, that you have high pain due to sickle cell. Sickle cell, state by state, in some states you will see it as a diagnosis like MS and cancer and things of that nature. In the state of Florida, sickle cell is not specifically named. However, there is a caveat in the law that says if you're suffering from any disease that presents the following type of issues, you too can get a card. If you have sickle cell, I'm almost guaranteeing you, in the 33 states that we have with a medical program, you would qualify for a card. So get registered. Just know that when you get registered using your card, the benefit off the bat is you're not having to pay the high extreme taxes, especially in an adult use state. So that means less money out of pocket. In some states, more than likely, you may be able to legally possess up to 2.5 ounces in a single 14-day period. Patients without a dispensary in their county may be able to cultivate up to 12 plants. And this was actually up in Nevada, where you can cultivate plants. So know your rights, know exactly, everybody has a Department of Health in your state. When you are, whatever state that you may be in, just know that you can go to your Department of Health and get the qualification, find a physician. If you can't find them, you make sure that you reach out to M4MM, because we have the resources. We have the people that have the know-how. We have our medical director is Dr. Joseph Rosado. He is experienced in working with sickle cell patients. If you need more support, or if your family needs support, that's what we're here for. We need your support in making sure that we keep eyeballs to this disease. It primarily affects African-American families. It affected my family. I live every single day praying that I won't get a phone call from Brian saying, "Mom, I'm in the hospital," or I don't feel good, or what have you. Every single day I'm asking him, "Brian, are you okay? How are you feeling? Are you taking care of yourself? Make sure you're resting. Make sure you're drinking lots of water." It affects our community, and I need folks to be more vigilant, to be more dialed in to what we need to do in order to offer cures. And so I want to put this out there. September is Sickle Cell Awareness Month, but we can do something from a cure perspective. We can be the match. Go to bethematch.org, BE, the match, MATH.org. If you are not registered to be a bone marrow transplant donor, and you're African American from the age of 18 and 45, please go register today. It's so simple. You register, they send you a packet. The packet, you receive it. It has 2 swabs, one for your left side of your cheek, one for the right. You take it, swab, put it in the packet. Take it, swab, put it in the packet. You send it back to the bethematch.org to their location. You're now in the registry. If someone ends up matching, you match with them, do you understand that you can be the difference between a cure? No more hospitalization, no more pain. I can't even tell you, like right now, Brian has been, his physician has said, yes, you would qualify for a bone marrow transplant. His insurance is expensive, has said, yes, we'll pay for it. You know why he doesn't have it done, or hasn't had it done yet? He doesn't have a match. I'm not a match. His dad is not a match. Somebody out there may have the right genetic proportion, because we all come from African descent, that would be the match, a better match for Brian, so that he has a successful transplant. I'm encouraging you guys, please consider joining the registry, bethematch.org, bethematch.org. Go check it out, register yourself, and let's make sure that we help people that need our support, and it comes from our community. I'm so excited to be with you today. I'm grateful for the opportunity. I love on my sickle cell patients. I love on your families, the caregivers. Just God bless you. I send you much love and positive energy. I know what you're going through. I've been through it, and I'm just so blessed beyond control to be able to be here today, to have an organization that can speak on these things. But as a mother, as a caregiver, I encourage you all to please consider cannabis as an option for care, for support for sickle cell patients. I'm Roz McCarthy, founder, CEO of Minorities for Medical Marijuana, here saying happy Black Cannabis Week. God bless and take care.